Our project, titled Collaborative Approaches for Supporting Survivors of Female Genital Mutilation, or cutting, simply FGM, was funded by the Public Health Agency of Canada in 2018. And the goal of the project is to develop an integrated FGM initiative which engages survivors of the practice, community leaders, service providers, for the purpose of enhancing supports for survivors and increasing opportunities to reduce the risk for female genital mutilation for the girl child. The objectives of the project include to develop a service providers framework for providing support for survivors of female genital mutilation, to develop a sustainable network of community leaders and organizations active in addressing the impact of FGM and working towards reducing the risk for the girl child. And lastly, to produce awareness-raising resources for survivors and mainstream media in order to strengthen the voice of women and communities to speak against female genital mutilation.
I think so many of us who have been working on this project came to realize that although there were some interventions for FGM, FGC across different sectors and for frontline service providers, a lot of that knowledge was coming from a very particular location and a very particular gaze that looked at survivors as victims that needed to be saving, that didn't take the agency of survivors into account. So that was really the primary need around this, and to teach people some important language to talk about FGM and FGC, and to create platforms so that survivors were the one that could tell their own stories and inform us about their needs, and for us to really understand that the needs of survivors look different based on who the survivors are, what their lived experiences are, their social locations, that kind of thing. So really the lack of survivor-led knowledge around this was the biggest motivator for the project.
More than 20 years have passed now, but memories are still fresh, and wounds are still open. The pain was severe, but the psychological pain lasts way longer. I was in pain, but being unable to understand what was going on was more painful. Lost, cold, isolated, drained.
Some healthcare providers feel like they don't have experience or they don't have the tools to provide appropriate healthcare for women who have been impacted by FGM, whether it's for labor, whether they are going for any gynecological examination. From immigrant perspective, I can speak to that. It's not like the healthcare system is not easy to navigate, and because the system works so fast, nobody's taking the time to explain what's going on, what's happening to the women. And especially when there is a cultural differences, when there is a translator involved, when there is women is not speaking the language and didn't know what's going on, it's very difficult situation to be at, especially when you are giving birth.
The role women's health played in the early 90s around female genital mutilation eradication is training of service providers working with women from practicing countries, particularly around health service delivery, reproductive and sexual health, educating the community to support them in eradication efforts. We were also very instrumental in changes in policy and legislation in Canada to criminalize the practice to protect the girl child. Moving forward to 2018, we realized it's important to revisit this work, start mobilizing and start supporting communities to deal with the practice.
Survivors are able to tell their own stories in their own words, they're able to identify their own needs in their own words, they're able to set their own boundaries, they're able to say yes, they're able to say no, and they're able to understand and seek support in the ways that make sense for them. So for me, that's the most important aspect of it, is we actually recognize that survivors are already resilient, that resilience is what it takes to survive up until this moment, and that it's about capacity building for all of us collectively to support the survivors really meaningfully.
My life, my body, my choice, no to FGM. It's time to stand together as parents and fight for our girls' rights. It's their right to make decisions concerning their bodies. Let us all say no to FGM.
When the program was being designed and developed at the very beginning, we were thinking about how are we incorporating, these principles of safety and empowerment and trustworthiness and agency, like collaboration, some of those principles that kind of guide trauma-informed care. How are we incorporating that into how we're even thinking about this project? I think a lot of that process really involved having space for people to say what it is that they need and what they want and what they're here for.
So my experience in the project is so amazing. Like I participated in the digital storytelling, which was it was very interactive. And then there was a sense of community where like other women who have experienced female genital mutilation were around. It was a safe space, which I felt like since I came here, like I've not been able to have, obviously. It's true, like I've been into the advocacy of female genital mutilation for quite a while. I've trained people and everything, but talking deeply about my personal experience, I've never done that. So this project actually helped me like search deep into my soul, reflect about my experience of female genital mutilation, which happened when I was really young, and the impact that it created as an adult woman. So I was able to like reflect on that during the storytelling.
I am a woman, a survivor, and no one can take that away from me. I'm not afraid anymore.
Success for us means like the women are empowered. There is a network of women that are supporting each other when they need to talk about these issues, because there's a lot of stigma around talking about the issue itself.
My activism is rooted in the idea that FGMC can be eliminated if survivors share their stories. Laws alone are not enough to make change happen, even though they're key.
If they feel fulfilled by the experience, and if they feel that they have the language, the tools, and the networks to advocate for themselves. And also when we see that the media community and the people who are telling stories about FGM and FGC have the language to do so in ways that don't further harm survivors.
I am whole, I am worthy, I am beautiful.